Welcome to my presentation. I am a physical therapist from Taiwan. The other two were from Losheng Sanatorium and Hospital and School of Physical Therapy of National Taiwan University. The topic I want to present for you is acute effects of a multidisciplinary program for community-dwelling older adults, a local study in Taiwan. This project was the health promotion program of the Losheng Sanatorium and Hospital of Ministry of Health and Welfare, Taiwan. This slide is the outlines of my presentation. I will go through from the introduction, including the background, literature review, and purpose of our study. Then, I will introduce the methods, the study design, outcomes measure, statistics methods and intervention programs will be included. I also present the results of this study, and finally go through the discussion and conclusions. Population aging is a global socio-economic problem including Taiwan. Older population of Taiwan was rising rapidly in the past decades, and it is estimated to rise over 20% on 2026. So it is very important issue for the aging society. Older adults might have to face many problems result from aging. For example, they may experience the muscle weakness, falls, and declination of cardiopulmonary functions and so on. And these declinations will result in disability of older adults someday. If we didn't face the problems, they would be a great socio-economic burden. The American College of Sports Medicine, ACSM, points out that aging causes cardiorespiratory endurance and muscle fitness to decline. Many studies have pointed out that regular exercise in elderly people can avoid chronic diseases, slow the deterioration of physiological functions, maintain health and well-being, and help to maintain physical functions, prevent or delay the occurrence of diseases and disabilities, improve the quality of life, and reduce the need for medical care and social care. From previous studies, we can find that the older adult engaged in regular exercises, this will be good for intelligence promotion and prevent dementia of older adults, and it also has benefits on health and quality of life for older adults. In this slide, we also find regular exercise is good for patient with chronic medical conditions. For example, suitable behavioral changes, regular physical activity and healthful diet can prevent adults from risk of cardiovascular disease. The purposes of our study were to conduct a comprehensive program to community-dwelling older adults to promote their performance and achieve healthy aging in place. We will investigate on regular exercise benefits for community-dwelling older adults' physical and fitness functions and effect of multidisciplinary program for physical function of community-dwelling older adults. Now, I will go on the methodology of this study. This slide shows the study design of present study. This study was a single arm and we conducted the assessments before and after intervention test. All the participants were recruited from the community of Hualong at the New Taipei City and they were purposive sampling. The inclusion criteria and exclusion criteria were shown in the next slide. For the health status, participants were sub-healthy but not dependent, including the pre-frail elderly. And all participants were informed and signed the ethic form before the study beginning. The inclusion criteria of participants were older adults are frail, pre-frail or they are in sub-healthy status. The exclusion criteria are people with cognitive impairment and cannot follow order, loss of vision, hearing impairment or speech disorder. For people they have severe arthritis or osteopathy affect daily activities. Are excluded. We also exclude people with poor motivation. Now, I am talking about the outcomes measure. The measurements were including the strength and endurance, flexibility, cardiopulmonary endurance and the balance function. To test the strength and endurance, we used the arm curls and chair raise test for 30 seconds, and recorded the repetitions the participants achieved. For assessing their flexibility, arm grab test and seated toe touch test were used. 2 minutes stepping was used to evaluate the cardiopulmonary endurance. We used the timed up and go test and one leg stand with eyes open for balance assessments. These measurements will be illustrated in the following slides. This slide was the 2 measurements for strength evaluation. On the left side of this slide, the arm curled test was used for upper limb. On the right side of this slide, the chair raised test was used for lower limb. We recorded the repeats in 30 seconds as an outcome measure. This slide was the 2 measurements for flexibility. On the left side of this slide, the arm grab test was used for range of motion of shoulder. On the right side of this slide, the seated toe touch test was used for lower limb. We measure the distance of 2 hands on back or fingertip to the toes in sitting position. And this slide illustrates the 2 minutes stepping. It was used to evaluate the cardiopulmonary endurance. For balance assessments, we use the timed up and go test showed in the right side of this slide and one leg stand with eyes opened in left side. The intervention program was a multidisciplinary program last for 12 weeks. It included 2 parts, nutritional education and exercise training. Nutritional education was delivered to the participants for 1 hour every week. The oral care and healthy diet education were conducted. The physical exercise training was aerobic exercise including strengthening, endurance training, flexibility training and balance training. Each session of physical training was 1 hour once a week. For the interventional program, it was a 1-hour comprehensive and multidisciplinary program. It included strengthening, balance, endurance, flexibility and nutritional education programs. In the strengthening program, we used the elastic bands as a resistance source. We encouraged the participants to move against the elastic bands in many directions of movements. For example, shown as this picture, we encouraged the subjects to elevate their arms and separated to achieve resistive shoulder adduction movement. For the balance training, it could be in sitting or standing position depended on the conditions of the participant. As illustration, they stepped out, weight shifted and moved in different directions with arms movements. For endurance training, all the participants were in standing position and executed stepping forward and backward. If possible, they also combined with trunks or limbs movements. Then, the flexibility exercise included the upper limbs, lower limbs and trunk. As illustrated, they performed the back and legs stretch. All these exercise training were delivered to participants for 1 hour, and the warm-up and cool-down phases were included. The World Health Organization points out that an unhealthy diet is the major risk factor for non-communicable diseases. According to the Survey of Nutrition and Health Condition of Taiwanese, the 6 categories of food intake attachments gravely deviate from the national dietary guidelines and recommended. So we encourage participants' intake of vegetables, fruits, and dairy products, and balanced enough calorie and high-quality protein-rich in nutrients, such as vitamin B6, vitamin B12, folic acid, vitamin C, vitamin D, dietary fiber, calcium, magnesium, potassium, and so on. At the same time, the elderly are often suffer from stroke, cardiovascular disease, osteoporosis, and muscle wasting. These may relate to their dietary habits. The course focused on these changes of physiology and neuropsychology, and nutritional needs, designed to eat enough in their diet and 5 fruits and vegetables every day, smooth diet series of healthy eating practices such as curriculum. People eat a healthy diet as a guidance idea, form a good healthy lifestyle, a balanced intake of various kinds of healthy food, and thus reduce the prevalence of obesity and chronic diseases, and then let the silver hair group correction to actively to face life, enjoy life happier. For the statistics, SPSS version 20 was used for data analysis. Demographic data and outcomes of all the participants were collected and were expressed mean and standard deviation. The difference of outcomes between pre- and post-intervention were analyzed with paired sample t-test at alpha level 0.05. Intention to treat was conducted for missing data to prevent the effects of dropout. A total of 30 subjects agreed to attend the study, with an average age of 70.8 years, 14 males, 16 females, and 4 males failing to complete the post-test evaluation for some reason. All subjects, including 4 who did not complete the program, were included in the statistical analysis at the end of the 12-week activity course. All the outcomes improved significantly except the flexibility of upper limbs. Strength of upper limbs increased 5.1 repetitions after intervention. For the lower extremities, we also found 4.8 repetitions increased. For the flexibility, the lower limbs increased 2.0 centimeters significantly but the upper limbs did not improve. The cardiopulmonary endurance had shown improvement after intervention by increased 13.5 steps. Then, the balance performance, the timed up and go test was 0.70 seconds shortened and the one-leg stand test showed 5.7 seconds increased. So, we can concluded that this comprehensive program can be benefit for the frail or sub-healthy people. Results of present study showed that this comprehensive program can be benefit for the frail or sub-healthy older adults in muscle strength, cardiopulmonary endurance, and balance performance. These findings are consistent with the previous studies such as Nelson and Liu. The resistive training could preserve muscle strength and improve functional performance. And the flexibility exercise can improve or maintain range of motion, these also found in Bravada's study. The present study found one-leg stand and timed up and go tests were improved, that is, after intervention our participants improved their balance performance. This result may be good for falls prevention. In the previous studies, Gillespie and Sherrington studies, they concluded that balance exercises can improve or maintain physical function and reduce falls in older adults at risk of falling. Further, in many studies had pointed out the enough of physical activity decreases the risk of chronic diseases and enhances treatment. A multidisciplinary program and regular physical exercise intervention could improve functional status in older adults. In future studies, we need a large sample size, long-term follow-up and randomized control trial to concrete these findings. Thank you for your attention. That's all for my presentation. And welcome to visit the beautiful island of Taiwan.